So when we're caring for a patient with increased intracranial pressure, one of the most important things that we need to consider and monitor is the cerebral perfusion pressure, or CPP. So what is CPP? Well, CPP is the amount of pressure available to get the blood from the heart or the systemic circulation up into the brain to perfuse it. Now, we calculate CPP by taking the mean arterial pressure, or MAP, and subtracting the intracranial pressure, or ICP. So the MAP is the average pressure in the systemic circulation moving upwards towards the brain, and the intracranial pressure is the pressure within the skull that's providing resistance or pushing downward. So what we want to do is make sure that the difference between the two, the leftover pressure, is enough to perfuse the brain, and that is our cerebral perfusion pressure. Now, we know that ICP is usually about 5 to 15. Mean arterial pressure, we usually want to keep above 65. But actually what we want for the CPP is for it to be greater than 70, okay? So sometimes that means we need to get that mean arterial pressure up a little bit higher. So let's say you have a patient sitting here with an ICP of 10. If we want a CPP of 70, we're going to have a mean arterial pressure that is greater than 80. So a lot of times we'll actually intentionally either create hypertension or allow hypertension to keep that mean arterial pressure up, to make sure that we have that cerebral perfusion pressure that is sufficient to get that blood flow up to the brain where it needs to be. Now, the problem for these patients is going to come when the ICP is too high or the MAP is too low. That would mean that the CPP, or the available pressure to perfuse the brain, is getting lower and lower and lower. So the closer your MAP and your ICP get to each other, so let's say your ICP is too high and your MAP is not that strong, then your ICP is going to overcome your MAP and you're going to have a smaller cerebral perfusion pressure. So the closer you are to CPP of 0, the closer you are to brain death. Now, CPP of 0 would be no flow at all. Nothing's getting upwards. Think of it like two people who are like pushing on either side of a door, right? So whichever person is stronger is going to get the door open faster and get through that door. If they are equal and have the same strength, then the door's not going anywhere, right? So 0 means nothing's flowing either way. So we want to make sure that that pressure upwards overcomes that pressure downwards from the ICP. So we're going to make sure we keep that blood pressure high. We're going to control their blood pressure, allow that mean arterial pressure to be higher than we normally would. And we're going to make sure we keep that ICP low. That might mean we drain CSF with an EVD or all of those other medical interventions we talked about, like mannitol, steroids, or 3% saline, or even that permissive hypocapnia to keep their CO2 low. We're going to do all these things, keep their blood pressure high, and keep their ICP low. Now, once your CPP does get to 0 and you're at no flow, that's it. Technically, we don't say there's a negative CPP, but I have actually had a patient who was herniating, and her ICP just kept going up and up and up. And right before she finally herniated, her ICP was 85 and her MAP was 80. So technically her CPP was -5. But unfortunately at that point, that indicated that she had no flow to her brain, and it did indicate brain death for her. Now, you will get to read more about her story in the case study attached to this lesson, so make sure you check that out. So remember that CPP is the amount of pressure available to perfuse the brain. Without a good CPP, the brain's not getting blood flow, and tissues that don't get blood flow will die. Okay? Remember that we calculate CPP by taking the MAP minus the ICP. So it's the difference between the pressure upwards and the pressure downwards. And our goal here is for that to be greater than 70. Remember, it's like the two people pushing on either side of the door. We need to make sure that our mean arterial pressure is pushing harder and faster than our ICP. So we're going to do whatever it takes to intervene, make sure our blood pressure stays up, make sure we keep that ICP low. We want to maximize